Hey, how are you? Okay. You found our office okay? Good, okay. And you're feeling comfortable? Good, okay. Well, my name is Dr. Cozy, and it's really nice to meet you. Can I really quickly, before we begin, get you to verify for me your name and date of birth? Perfect, okay. Alright. So you do already wear distance glasses, computer glasses as well, but recently you've started seeing streaks in your vision? Okay. Are you feeling like your ability to see near and far is changing even with your glasses? So just the streaks are new. Okay. Are the streaks worse when you're wearing glasses or worse without them? You're not noticing a difference? Okay. How about, is it worse at night or in the dark? Not sure. Okay. Any headache or eye strain? How about ocular migraines? Any new floaters or dark spots? Can you describe the streaks for me? Are they always at the same angle or? Okay. And did this start suddenly, or was it something that you kind of noticed developing over time? It's actually really common. As we get older, that all of a sudden our vision can just change. So don't be alarmed. It doesn't necessarily mean that there is any kind of injury or any kind of illness that's causing this. It could just be aging. But we'll take a look and see what we can find on exam, okay? Okay. Try to stay calm. We're here to figure this out together, and regardless of what we find, we'll take care of it, okay? Okay. Alright. Okay, I'm just checking your medications and allergies. Okay. So I am going to be dilating you today. Have you been dilated before? You're extra sensitive to it? Same here. So then you might know that you will have some issues with nearsightedness, like being able to read. You'll be definitely sensitive to light for probably up to 2 or 3 hours. So just be aware if you need to read anything that it might be difficult. If you have reading glasses, those should help a bit, okay? Yeah, you'll be fine to drive. It's just things that are more up close that are difficult to focus on. Okay, so I want you to keep your glasses on, okay? And we're going to start really quickly just with the old vision chart here. Actually, how about this? Can you please read for me whichever line you feel most comfortable reading? Okay. Are you able to see anything here? Good. And how about that line right there? Good. Good. Then how about let's get you dilated. So if you don't mind taking your glasses off for me, you can just put them right on that counter right there. Okay, so I'm going to tilt your head back if that's okay with you. Good, thank you. Just here suffices, okay? Is this okay? Any strain on your neck? Okay. It'll be quick regardless. You ready? Okay. Blink a few times for me, please. Thank you. Go ahead and put your head back up. Let's do something about that. Under there. I'm going to take my gloves off now because I don't need them anymore. And just going to take a few notes while we wait for that dilation to kick in. Shouldn't take very long. Okay. Yeah, we're getting there. I'm going to go ahead and turn off some lights, okay? We put the one over the headlight so that way we can still see what we're doing a little bit. But okay. find my pen light. Okay. So this may bring back those streaks in your vision again. Hopefully that's not too distracting. I just want to examine your optic nerve, okay? So try to keep your eyes open. Focus right here in between my eyebrows. Good. Okay. I'm going to move to the side of you. And just looking at your eye from a lateral position. Alright. And the other side. Just gaze directly ahead, please, if you don't mind. Perfect, okay. And then if I can just have you follow my light here for me. Don't turn your head, just using your eyes. Good, okay. So, did that give you any kind of eye strain, any exacerbated streaking? The swing test, a little, okay. Well, the good news is that both of your pupils are dilating equally. They have a nice response time to the change between light and dark. And I didn't see any issues when I looked laterally or watching your eyes while you tracked my light moving, so those things are very positive. Okay, now I'm going to look using my ophthalmoscope here. So, again, sorry, my hair is rambunctious. Try to keep your eyes open, but it's totally okay if you need to blink, okay? Just watching the reflection of the light into your retina. Okay. Everything looks good here. So now I'm going to look with a different kind of light, okay? So, just apply that on me. Okay. So, as you can see, this little light here is kind of a bar. I'm going to be using it to sort of match up and line up with the inner workings of your eye, okay? It might take a few moments as I find the correct angle, the correct width, so try to be patient with me if you don't mind. And if you can gaze over my shoulder here at that chart and just focus on reading it. You don't need to read it aloud unless you'd like to. Do the other eye. So again, if you can gaze over here at my lamp, that would be very helpful. Curvature is the same. So now we're going to use some of the equipment here that we have. We have our keratometer as well as our slit lamp. And we're going to start with the slit lamp, okay? So I just need to move this into position. So bear with me for just a moment, okay? So I'm going to move the chin rest up slightly. I'm going to bring you just a little closer, okay? Okay. Now I'm going to lower down. Like so. Can bring your head forward. Perfect, okay. Just gonna position. Alright. with this, I'm going to be looking very closely at your eyes. It's kind of like a microscope specifically for your eyes, okay? So this is going to let me see if there's any kind of changes that we need to be concerned about inside or on the surface of the eye. Can you look over here at my finger? Perfect. Just keep your gaze over there. Okay. And then look straight ahead. Looking straight ahead, you're doing great. Okay. Now look over at this finger. Okay. Good. Keep looking over here. Look straight ahead for me. Looking straight ahead. Turn your gaze to your left. straight ahead. Watching your pupils retracting and dilating. First of all, there's a contrast between these two lights. Can you tell the different colors? Okay, good. Let's have you gaze to the right again, if you don't mind. Straight ahead. Okay. And to the left. Straight ahead. Alright. Just another moment here. You're doing great. And just let your gaze go soft. Just go ahead and stare right into space for me. Beautiful. So you can go ahead and remove your chin from the chin rest. I'm just going to loosen this. Swap that out for a moment, so just sit tight. Okay, so this thing looks like a giant telescope. It is a keratometer. And what it's going to do is let me measure the curvature of your corneas. Depending on that measurement, it can help us determine if there is astigmatism present. All right? Okay. So when you're ready, go ahead and lean forward. All right? Perfect. And to start, going to shine a light through the lens at your cornea. So now I need you to just bear with me. I'm going to be finding the midline here. Getting our horizontal and vertical lined up. Okay, so just keep looking more straight ahead for me. You're doing great. You still comfortable? Okay, good. So, switch eyes here. Use my light again. You can go ahead and move your head back, okay? And then move this out of the way here. Okay. So I'm going to turn the lights back on, okay? And then I'm going to be taking a few notes, so bear with me. How's that with the lights back on? Is it okay? Are you having any kind of strain or discomfort? Okay. It might take a couple of minutes to adjust with the dilation. So, okay, I just need to document really quickly. Okay, so I did see some curvature. Your left eye has an axis of 153 degrees. Your right is 156, so that basically describes the angled streaks that you're seeing. So we will write you a new prescription for some new distance glasses to take that into account, okay? Okay, good. Before I write that prescription, I just want to do one more exam here while I have you here. And that is just to palpate around your eyes, just making sure that there's no sign of any kind of inflammation, infectious process, even things like styes, which are a skin malady. My brain wanted to say skin and sty at the same time. We always like to check all of our patients just to make sure that if there's anything they might be missing or not know to look for, or something that might be in the process of developing, we're able to take care of it before it gets too uncomfortable. So to start, I'm just going to take a look at you. Can you close your eyes for me, please? Great. Okay, you can open. And if I can just have you look up for me. Perfect. And I'm going to hold your eyelids if that's okay. Thank you. I'm just going to hold them open. If you can look down. Great, okay. So you can relax. And now I'm just going to be very lightly palpating just with my fingertips. Do you ever have any kind of tenderness? Okay. Usually if there's any kind of skin issue or issue with the surrounding eyelashes, it's pretty hard to miss, but sometimes these things can develop more subtly, so that's why we check. Can you close your eyes? Thank you. You can open. not seeing or feeling anything concerning. So that's good. So, okay, let's get you this script written up. And OS. Okay, so the prescription I'm writing is for distance glasses, but really quickly, are you having any of these similar issues when you're on a computer or when you're reading? Okay. If those start to develop, then we'll get you some reading and computer glasses with the new prescription, but usually people don't have the same issues. But again, that depends on what kind of screens they're looking at. Okay, sorry, I had to write a quick note there. And then, would you like us to add blue blocking to these glasses? Can do that. And we'll do the package that comes with the glass cleaner. Okay. Just making sure I didn't miss anything because our optician can be a little particular, so I just like to make sure. Alright. So, if you go out to the front, which you would have seen already in the waiting room, you'll see that we have quite a selection of different frames. And there are a few different desks where you'll see people sitting, helping people choose them and try different frames on. And then they will look into your insurance, if you have insurance, to see what your coverage is. And if you don't, then they'll help set up a payment plan for you. Okay? Okay. I'm pretty sure there should be some desks open. We don't usually get so busy that every single desk is occupied. But even if that's the case, it should only be a few minutes of a wait, okay? I do highly encourage you to do this today so that way we can get these to you as soon as possible, because very frequently the turnaround time for some new frames is about 2 weeks. Okay? Okay. And especially when it comes to astigmatism, we like to get people their frames right away, because if in fact they need to drive at night, they're able to do so more safely. Okay. Yeah, those LED lights on cars can really blind you. I have astigmatism also, so I totally know how it is. But okay. Do you have any questions for me before I step out? Okay. Well, if you need any, there is some tissue right here. I know sometimes when your eyes are dilated, there can be a little bit of tearing. So you're welcome to take what you need, and I'll see if actually I can get someone ready for you on my way out, okay? Okay. It was really nice to meet you, and you take care.